You are viewing a training module regarding how to comply with the requirements for medication reconciliation and management in the home health environment. Let's quickly review the learning objectives. By the end of this learning module, you should be able to verbalize an understanding of the importance of medication management within the home care setting, be able to verbalize understanding of the difference between medication reconciliation and medication review, implement best practice for completion of medication reconciliation and drug regimen review in your practice, demonstrate an ongoing ability to write medication orders correctly, demonstrate the ability to teach patients and caregivers, and be able to verbalize best practice documentation of interventions regarding medication. Who is responsible for medication reconciliation and review? Registered nurses and LVNs, physical therapists, occupational therapists, and speech and language pathologists are all responsible for medication reconciliation and review. What is medication review and medication reconciliation? Review is the process of reviewing all medications the patient is currently taking, while reconciliation is the process of identifying the most accurate list of all medications that the patient is taking, including name, dosage, frequency, and route, by comparing the medical record to an external list of medications obtained from a patient, hospital, or other provider. When is medication review and medication reconciliation required? Every visit requires some form of medication review and reconciliation for clinicians to remain compliant with regulations and to demonstrate best practice standards. When is medication review and reconciliation required? It's required at start of care, at recertification, at resumption of care, at discharge, and with every visit in between those events. Why is medication reconciliation, evaluation, and teaching important? Well, let's look at 5 reasons. Number 1, Medicare regulatory standards require drug regimen review as part of the home health conditions of participation. Number 2, Joint Commission National Patient Safety Goals require medication reconciliation for compliance. Number 3, St. Joseph's Home Health Quality of Patient Care Star Rating is affected by M 2016 on the Transfer and Discharge OASIS. Number 4, St. Joseph's Home Health Patient Survey Star Rating is affected by our attention to medication teaching. And finally, number 5, it prevents rehospitalization. Let's look at what Medicare states about medications in the home health environment. Reason number 1, Medicare regulatory standards require drug regimen review as part of home health. COP 484-55. The comprehensive assessment must include a review of all medications the patient is currently using in order to identify any potential adverse effects and drug reactions, including ineffective drug therapy, significant side effects, significant drug interactions, duplicate drug therapy, noncompliance with drug therapy. CMS takes medication reconciliation very seriously. Surveyors spend more time auditing medication reviews than any other task. Agencies face stiff fines for inaccurate or incomplete documentation. Fines can be as high as $10,000 per day, and agencies can be placed in an immediate jeopardy designation and risk losing licensure. And what does the Joint Commission have to say about medications? Reason number 2, the Joint Commission National Patient Safety Goals, or NPSG for short, require medication reconciliation for compliance. NPSG 030601 states that the agency must maintain and communicate accurate patient medication information. The elements include obtain and update information on the medications the patient is currently taking, define the types of medication, the name, dose, route, frequency, and purpose, compare medications taking versus ordered to resolve discrepancies, provide written information on the medications to the patient and/or caregiver, explain the importance of managing medication information. Furthermore, the Joint Commission Medication Management Standards, MM for short, include the following additional requirements. Medication orders or prescriptions are clear and accurate. Medications are safely and accurately administered by patients and patient families. The organization monitors patients to determine the effects of their medication. The organization responds to actual or potential adverse drug events, significant adverse drug reactions, and medication errors. The organization evaluates the effectiveness of its medication management processes. This includes medication reconciliation. Are the requirements as clear as mud for you? And are you wondering, how do I comply with the review and reconciliation requirements? The following details the steps to a successful outcome. This medication R&R tool was developed to help the clinician create habits for thorough completion of medication reconciliation and review. For instance, set the expectation with the patient and caregiver that you will be performing a review of the medications at each visit. Ask them to have all medications available for you to see upon arrival for the visit. This includes all prescription and over-the-counter medications, drops, creams, ointments, herbal or vitamin supplements. Don't forget to ask about injectables, transdermal medications, and oxygen. This practice will make the process as efficient as possible. At start of care or resumption of care, ask for any discharge instructions. Use this list and/or the list the patient has on hand and compare with the medication bottles and containers. Any discrepancies need to be clarified with the doctor. Ask if the patient has any prescriptions that have not been filled and picked up from the pharmacy. Make a note to follow up at the next visit and add these to the medication profile only after the medication has been obtained and started. If there are medications the patient is not currently using, ask if they are willing to keep these separate from their current medications in order to avoid confusion. Instruct the patient to keep all medication out of reach of small children and pets. Create a list of the patient's current medications. This can be adapted from the discharge instructions or any other list the patient uses. Enter all medications in the medication record and perform the medication reconciliation. Notify the MD of any problems or need for clarification. A printout of their current medications will be sent via mail within 5 days of admission for you to maintain in the patient's folder at subsequent visits. Make sure the patient is safe with medications until the next nursing or therapy visit. Begin teaching medications, but do not attempt to teach all medications at the first visit. At subsequent visits, make sure to ask if the patient has seen the doctor or has been to the ER. Ask about any medication changes, but also have them show you all their medications for review. Check the organizer, if the patient uses one, to see if he is compliant with taking the medications. For additional guidance, refer to Mastering Medication Management, which can also be found in box. The highlights of the handout Mastering Medication Management include the following. Resolve medication discrepancies as soon as possible. Write all medication orders clearly and concisely, including all required information. Update medication profiles with each medication change. Perform drug-to-drug interaction report with each medication addition. Complete some form of medication intervention, evaluation, or teaching at each visit and document. Review medication bottles. Don't just ask the patient. Documenting your medication teaching is required to fulfill the regulations for managing medications. Your documentation within Kinzer is twofold and includes all medications. The first part is documenting within your clinical note. For instance, here is an example of documenting teaching for Lasix. Indicate the details of the teaching, including medication name, purpose, dose, common side effects, schedule, and special precautions in the comments section above the MAR button. The second part is documenting within the medication profile. Here is the example for the same Lasix teaching. Notice the terms teaching and taught are used, including date. Clinician initials should also be included, although they are not shown here in this example. Taught indicates this medication has been taught, and the patient is able to teach back all instructions 100% without cueing. While teaching indicates you are in the process of teaching the medication, but the patient or caregiver are not 100% knowledgeable of the medication at this time. In 2017, OASIS C2 was implemented. Let's review briefly the changes related to medication management. Reason number 3. St. Joseph's Home Health Quality of Patient Care Star Rating is affected by how we instruct patients on medication management. Question M2016 on a transfer or discharge OASIS asks, at the time of or at any time since the previous OASIS assessment, was the patient or caregiver instructed by agency staff or other healthcare provider to monitor the effectiveness of drug therapy, adverse drug reactions, and significant side effects, and how and when to report problems that may occur? Potential answers include no, yes, or NA. Our agency answers yes 99.6% of the time, and that earns us 4 stars. Our goal is 5 stars, but that would require the answer to be yes 100% of the time. Are there times when a no answer is appropriate? Yes, but only on rare occasions when the patient was transferred or died unexpectedly before the medication reconciliation could be completed. Let's look at how medication affects our patient surveys. Reason number 4. St. Joe's Home Health Patient Survey Star Rating is affected by our attention to medication teaching. Patients are asked the following questions after discharge. Note the focus is on the last 2 months of care. Question 11 asks about any new or changed medications. Question 12 asks if we instructed on the purpose for taking medications. Question 13 asks if we instructed on when to take medications. And question 14 asks about our teaching of side effects of medications. Our current rating is 3.5 stars. Our goal is 5 stars. How do we improve our patient survey star rating? A few helpful hints for best practice. With each visit, even with long-term patients, ask and look whether medications have changed and if patients are aware of possible medication side effects. Don't overwhelm patients with multiple side effects. Discuss the most common side effects and how they can be managed to maintain patient drug therapy. Take cues from patients regarding their understanding and comprehension. If they appear overwhelmed, revisit the topic later. If they appear uninterested, provide them with written information and place it in the folder to review later. Review medications at discharge and provide teaching as needed. Reason number 5. Close monitoring of medications helps prevent rehospitalization. A large percentage of rehospitalizations occurring within the first 7 days after discharge is medication-related. Poor medication management causes rehospitalization because patients keep expired medications. Patients are confused about the dosage they should be taking. Patients have duplicate medications and don't realize it. Patients forget to take medications. Patients become confused about the timing. And patients keep discontinued medications. In summary, medication reconciliation and review are vital in meeting the St. Joseph Standard of Excellence while providing home health service to our patients. We each have a responsibility to ensure our patients are benefiting as much as possible from their medication regimen by teaching, monitoring, and instilling independence with justice. Frequent medication review is necessary to prevent rehospitalization, foster rehabilitation, and promote dignity in each of our patients during their home health experience. Thank you for listening to this presentation regarding medication review and reconciliation. For more information, please consult your manager, supervisor, director, or educator who will be happy to answer additional questions.